creates a pumping action that brings this fluid all the way up. So when this gets stuck, it creates headache, especially if you have a job that you sit a lot. Hello, this is Dr. Marcel from Soft Touch. Today's topic is headache. A lot of you are asking me about why we have headache that they don't go away, and of course the most common is migraine. I notice I have a lot of my patients, they have headache that is really originating in their low back, because there is a fluid we call cerebrospinal fluid. Cerebrospinal fluid is a fluid that goes all the way from around your brain, goes all the way to your back. And there is a bone at the very end, we call it sacrum. And is very underdiagnosed. Because a lot of us, we go to work, we sit at the desk and we have a desk job, our back gets fixated. And that fixation on the lower back can cause headache, and I will explain it in a minute. It's basically come down to cerebrospinal fluid. It's a fluid that goes around your brain, goes all the way down to your back and back up. And when you have a fixation in your lower back, that stuck this fluid circulation. And the circulation of this fluid, clear fluid, it causes headache, a swelling around the skins that covers the brain, and that causes the headache. If you go to Wikipedia and Encyclopedia Wikipedia and punch in cerebrospinal fluid, you literally can see the MRI, functional MRI, and you can see the pulsing of the brain and movement of this fluid. Sacrum, you can see it from here and here. This bone literally goes, every time you breathe, it pumps back and forth, and it sends the fluid all the way up and brings it down. Literally pulls this fluid up and down. So if you have a back problem that it creates a fixation, this one headache that is not hormonal, it eventually becomes hormonal, but if you have a stuck sacrum, that create a headache that easily fixable by adjusting and creating motion in your low back. In this case, you can see the shape of this bone. This is sacrum right here, from the side, and from the front. You see this fluid goes all the way between all this vertebrae, all the way to your brain. So this is literally have a pumping action, goes up and down. You see, even looks like a pump. See those old 17th century pumps that they would move them and then would create pumps? This is exactly like those. It moves, and this movement creates a pumping action that brings this fluid all the way up. So when this gets stuck, it creates headache, especially if you have a job that you sit a lot.